Can sleep apnea cause aspiration? If you or someone you know has sleep apnea, you might be wondering if it can lead to aspiration, which is the inhalation of food, liquids, or other substances into the airways. Let's break down the connection between these two conditions. Sleep apnea is a common sleep disorder that causes repeated pauses in breathing during sleep. There are two main types: obstructive sleep apnea, OSA, and central sleep apnea, CSA. OSA occurs when the muscles in the back of the throat relax and narrow the airway, while CSA happens when the brain fails to send the right signals to the muscles that control breathing. Now let's talk about aspiration. Aspiration can happen during sleep, especially in people with sleep apnea. Studies have shown that individuals with OSA are at a higher risk of aspiration. Here's why. During sleep, especially in the REM phase, the muscles involved in swallowing and breathing can become less coordinated. In people with OSA, the airway obstruction can lead to changes in intrathoracic pressure and a weaker cough reflex, making it easier for substances to enter the airways instead of the esophagus. Research has indicated that swallowing events during sleep are more common in patients with OSA than in those without the condition. These swallowing events can occur during both non-REM and REM sleep, and they are often associated with an increased risk of aspiration. For instance, about 30% of swallowing events in individuals with sleep-disordered breathing occur during inspiration, and more than 50% occur during the end-expiratory phase, which can increase the risk of aspiration. Additionally, the use of continuous positive airway pressure, CPAP, therapy has been shown to reduce the frequency of swallowing events during sleep in patients with OSA. This suggests that the positive pressure from CPAP can help stabilize the airway and reduce the likelihood of aspiration. In summary, sleep apnea, particularly obstructive sleep apnea, can indeed increase the risk of aspiration during sleep. This is due to the disruptions in breathing and the altered coordination of the muscles involved in swallowing and breathing. If you have sleep apnea, it's important to work with your healthcare provider to manage the condition and reduce the risk of aspiration and other related health issues.